that Real also then had a Black OBGYN that came. She was in the same exact situation. Now, this is probably less than 10, 15 years ago because she was a young physician. And it was a Black physician that was in the room. The white physician said, "Have you ever seen a fourth degree?" And it was a Black physician that stopped the doctor. She was actually a resident at the time, and stopped the doctor and said, "No, you will not do this." Regardless of what the outcome would have been, she stood up. And so that's why we're saying it is so important that we have a seat at the table, that we go into these areas of medicine, and that we are represented to make sure that everyone is taken care of.
Remember the doctor during COVID? She was on the news. She was actually in the hospital, and she was telling the other physicians what she needed and what was wrong, and they still didn't address it. And I think she ended up dying. Do you remember that situation?
There's many of those. If
But I
that's
mean, she was
one that
all on
I'm
the news during
remembering,
COVID. She was
yeah,
all on the news.
yeah, yes, for sure. No, that and it happens. You know, I mean, women are. I tell my patients, "Hey, I'm not inside of your body." Typically, most of the time, women know something's wrong even before it shows up. So if a woman is telling you something's going on, you have to listen. You have to make sure. Typically, I will go above and beyond. Typically, sometimes in medicine, they may say, "Oh, well, maybe you shouldn't have done those particular tests." If someone is saying that they are experiencing something, I am going to listen. I would rather be on the other end of finding out that everything is okay than finding out that something is wrong after I sent this lady home, or after something happens and then I have a bad case. And so it just really takes time. It takes compassion. It takes a calling, because no matter if you're in medicine or wherever you are, you have to listen to people and their needs.
That's true.